my name is Dr. Mitch Wicker. I've been a part of the ARH family for the past 41 years and a part of the Graduate Medical Education Department for the past 3 years. I function as the designated institutional official for our GME department, and in particular at this time for the Internal Medicine Residency. What that means is that I make sure that the Internal Medicine Residency has everything it needs to provide top-notch, state-of-the-art education for our internal medicine residency.
Our program has been around for about 3 years, and we train people to be excellent internists, whether they decide to stay in primary care or whether they decide to go on and specialize in cardiology or pulmonology or whatever they decide to go on and do. And our residents train mostly at their own site, either at Whitesburg or in Harlan. We train quite a bit in Hazard as well. And really throughout the system, one of the great things about the ARH system is that we have doctors of all kinds that are spread out throughout this large hospital system that we have. So we're able to find those excellent docs and send our residents out to work with them.
Here at our Whitesburg site, we do all of our inpatient management in the hospital here. We don't do any internal medicine rotations outside of here. So all the patients that you see in the hospital will follow you up in clinic. We have specialties here. We have infectious disease, we have nephrology, we have cardiology, and you will spend time with all of those attendings one-on-one. Usually you'll be on your own. There may be one medical student with you. You'll do your specialty rotations at Hazard. We have general surgery, but we get good exposure to all specialties here, and I'm very proud of that. I feel very well-rounded.
When you come into the program, we have a template ready in terms of what kind of research are you interested in, and then accordingly we can kind of pair you with a mentor. It's just unbelievable the amount of diverse pathology that this area has to offer, and there's so much to be done. And as a trainee, as a learner, this is where I would want to be.
When I started my residency here, I really liked the environment over here, and the people in the community are so nice that we decided that we are going to stay here.
I think what sets us apart is that we're entirely rural, and I think that in terms of training, what that means is that we have a focus on the particular issues that come along with rural practice. Now, I believe that that training here will take you anywhere. I believe you could go to Lower Manhattan. I believe you could go to Paris, France, and be in excellent position there after your training here.
For me, when I was choosing residency programs, I'm from a rural area, and I knew I wanted to practice medicine in a rural area. So ARH residency program offered me an opportunity to get to work on the community that I want to treat for the rest of my life and learn while I'm working with this community. So it offered me a good opportunity to become familiar with the pathologies that are common in this area.
I chose the ARH residency program because I wanted to come back home and provide care to a very underserved area.
My favorite part of the residency program at ARH is the close ties that I have with the physicians and the other residents that we have. This is a smaller program, so we get a lot of close one-on-one time with the physicians, and us residents have grown really close to each other, and it feels like a family.
Having grown up here, I understand the needs of our people, and I look to serve them once I'm done with the residency program here. And I think that being able to train with this population is the best way to be able to treat them going forward.